we're going to talk about how you use a client's schema to increase your ability to effectively teach them skills that'll be useful in therapy. Now, schemas are basically our cognitive construct, our belief system, our expectations, our concepts of how the world works. And that all comes from what we've lived. Remember, we only know what we've lived. But that also creates a knowledge gap. New information is suspect. And it's up to us as the therapist to figure out ways to bridge the gap in our clients' knowledge, to teach them things that they came to us for, or that will be useful to reduce their symptoms and bring about the change that they want to see in their life. Now, one of the first questions I ask a client when they see me for an appointment oftentimes is, what has the greatest accomplishment been in your life? And, one time I had a young person who I had seen, and this young woman, she said, well, I really can't think of much. She was relatively depressed and very down on herself. So it was very hard for her to imagine anything that she had done right. So she took a while, and then she came back with me and she said, well, you know what, mister, I did get a scholarship for softball. I said, well, that's fantastic. How did you do it? And we started to explore her pattern of success. But she talked to me about how she got the scholarship for softball, and it came up that she was a pitcher. And, she talked to me about how she had pitched in different games and, playoffs and all these different events. And it became apparent also in our conversation that this young person's symptoms and their pain, a lot of the depression they were experiencing was also due to a rigidness in the way of thinking. They had expectations and judgments about themselves and their life, things that they should have done, could have done. And so in the back of my mind, I went back and said, well, what is it that we can do with this whole concept of pitching? And I remembered that, this will be useful. And so, we went back, and I asked her, what would happen if I threw, a pitch and I was incredibly rigid? What would happen to you if you tried to be really strong and really powerful and just held that tension in your arm while you threw it as hard as you could? And she said that wouldn't work at all. It actually would, hurt your hand, and you probably wouldn't make it to even, home plate. You probably wouldn't throw as far, and it would be inaccurate, and there'd be a lot of problems. You wouldn't do well at all. I said, well, what do people do to pitch well? She said, well, you got to teach your hand to loosen up. You got to be flexible. That's why people are, practice the exercises they do. And so we started to talk about flexibility and what that means and the dangers of tension. And then we transferred that understanding then to cognitive rigidness and belief systems and thinking, and the benefits then of utilizing mindfulness and flexibility of mind. And in conversation with that, we were able to kind of bridge her gap in knowledge. It just made more sense far quicker than I think it would have been if we had not really utilized softball as a starting point. So again, when you want to teach your client something new, start with something that's already known and experienced. It's a great place to build off of it. Thanks.